This kick should be banned from the UFC and mixed martial arts fighting.
Oh no, I hope I don't fall.
There, I said it. And I'm going to explain why they should be. The oblique kick is an uncommon lower body kicking technique that has been used in mixed martial arts fighting. It is also known as the scoop kick or the push kick to the knee. Although it appears relatively simple, it is quite effective, can be potentially devastating, and is variable in its use, allowing fighters a number of ways in which it can be performed. As the authors state in an article about the oblique kick, it can be used when tied up in close, or it can be used at range. It can be used to defend against a charging opponent, or it can be used as a setup to another move. Although the oblique kick has always been an option, it has not commonly been used by many fighters. Two fighters who have used the oblique kick quite effectively are Jon Jones and Holly Holm. Both fighters have put the kick to good use in several fights in the past. Jones in particular has made the oblique kick an integral part of his arsenal of tools. He has used the technique on many occasions in combination with elbow strikes to subdue a number of opponents, including Rampage Jackson, who is not in favor of this technique. Holm used the technique efficiently to slow Ronda Rousey before defeating her with a head kick in their historical contest.
Boom! Head kick, goes down and hunches. Let's look at it one more time. Ba-boom! And she is out cold.
The intended purpose of this kick is to hyperextend the knee by kicking either the shin or the thigh backwards. The knee, which is a hinge joint, is quite limited in its degree of freedom. Its primary plane of movement is the sagittal plane, meaning that it hinges and slides front to back. It could also accommodate a small amount of rotation in the transverse plane. However, it does not allow any significant movement in the frontal plane and has robust ligamentous stabilizers that limit the ability of the knee to move in these directions. By kicking the knee backward, you force the knee beyond its natural range of motion. When this kick is utilized against a fighter, they are faced with two choices: stop what they are doing to avoid or defend the kick, or suffer the painful consequences of proceeding when they should have stopped. Fighters such as Jon Jones have used this kick to great effect to control aggressive opponents who might have otherwise proceeded forward in an unrelenting manner. So what does it do, and what damage does it cause? Generally, the passive range of motion of the knee in the sagittal plane is between -10 degrees of extension and 150 degrees of flexion. This means that if there is no resistance, the knee actually hyperextends by a small amount. But what happens if the knee is forced into more extension than it can normally accommodate? The knee is stabilized by ligaments inside and around the knee, which prevent it from exceeding its passive range of motion in any plane. There are four major ligaments that stabilize the knee: the cruciate ligaments that cross each other within the knee, and the collateral ligaments, one on each side of the knee. The cruciate ligaments, in combination with the joint capsule around the knee and the muscles behind the knee, prevent abnormal extension of the knee. The collateral ligaments prevent abnormal opening of the knee to either side. When the knee is forced into extension by a blow to the front of the knee, the cruciate ligaments are sequentially tensioned until failure. If the deforming force continues, the posterior capsule behind the knee is also disrupted as well. With these ligamentous injuries, the knee becomes unstable in the sagittal plane and can no longer resist extension. For the record, this is a bad thing. It is difficult to walk or even stand with this degree of instability. And if the deforming force is angled from the outside, the collateral ligaments can become involved, and the instability is likely to be even worse. Talk about a freaking bad day. These are not the sort of injuries that you simply walk off. There have been some occasions where this kick has been used with devastating effects on opponents. Jon Jones used this kick effectively against Rampage Jackson in their 2013 fight. Rampage required an extended period of convalescence after his bout to recover from the injury suffered. Jones also used this technique against Lyoto Machida, although the injury suffered wasn't as bad. Other fighters who have been injured in the past by this kick include Mauricio Hua and Norifumi Yamamoto. More recently, Khalil Roundtree used this kick to horrifically stop opponent Modestas Bukauskas in the second round of their fight at UFC Fight Night Brunson vs. Till. Roundtree struck the outside of Bukauskas' knee, forcing it backwards and inside at the same time. The ringside physician reported that he had suffered injuries to the ACL, MCL, and PCL ligaments. While this was not confirmed by reports following the injury, it would be consistent with the injury mechanism that was observed. However, in an interview with Ryan Truman of MyMMAnews.com, Bukauskas stated that he would be back to training in about 4 to 5 months. This is definitely not consistent with these diagnoses, which would require over 12 months rehabilitation before even considering returning to training for MMA. This suggests that either he didn't suffer the injuries put forward by the ringside physician, or he is way more optimistic than he has any right to be. But judging from the dressings visible on a recent Twitter post, I would suspect that he had suffered both ligamentous injuries to at least one cruciate and the medial collateral, as well as a fracture of the proximal tibia. The medical suspension handed out by the Nevada Athletic Commission for Bukauskas is 6 months, suggesting that the injury is potentially less severe than initially suspected. Although this has not occurred frequently in the UFC, the potential for catastrophic injury is always there with this technique. The unified rules of mixed martial arts do not prohibit this technique. The only kicks that are disallowed are knees or kicks to the head of a grounded opponent, kicks to the back of the head, and groin kicks. Thank goodness. So, if it is not disallowed, it is in essence endorsed by the UFC as an acceptable technique for use by fighters. To me, this is a problem, and I am even a fan of mixed martial arts fighting. In my opinion, this technique should be banned by the UFC. Now, I know there are many fighters and fans who would suggest that this technique should be allowed, including Bukauskas himself, who bore no ill will toward Roundtree, and announcer Michael Bisping as well.
And if that's how you feel, then you are out of your goddamn mind, right? Because it's a tough sport.
But as a medical professional, I believe that this technique is of particular concern, and I'll tell you why. In my opinion, there are two main reasons why I feel that this technique should be banned from use in the UFC. First, this technique is designed to force a joint beyond its anatomic limit, forcing the joint into a range of motion where ligamentous injury occurs. In this manner, this is not different from any joint lock techniques such as an arm bar, a knee bar, or an ankle lock. The key difference, however, is that with each of those techniques, the fighter on the receiving end generally has an opportunity to recognize the technique being applied and tap before severe injury occurs. While the threat of injury looms overhead, a fighter can take action to prevent it. Where the oblique kick is concerned, the kick, typically delivered in a stabbing or percussive manner, does not afford the fighter a significant opportunity to respond in a protective manner. By the time the kick makes contact with the fighter's leg, the injury train has already pulled out of the station. Were there more of an opportunity to react and respond accordingly, I can see Bisping's point. However, here, the threshold between a successful defense and a catastrophic injury is razor thin. Given the fatigue that fighters face during these matches and the potential for impaired judgment after receiving a number of head blows, I think that it is quite easy for fighters to miss an opportunity to react in a way that would prevent a terrible injury. In my opinion, it is medically safer to simply disallow this technique in the same way that throat strikes, fish hooks, or eye gouging are disallowed. The second reason I feel the technique should be banned is largely an extension of the first. There are several techniques, some of which I just mentioned, that are banned in the unified rules of MMA. These techniques are banned because of their danger to the fighter receiving technique, and because they are techniques that are associated with no-holds-barred street fighting, which the UFC is not. The UFC is a professional mixed martial arts organization that provides itself in its separation from other lesser organizations, boasting the best talent, offering the best fighting entertainment. The UFC doesn't offer street fights. It offers officially sanctioned combat contests between professionals. While the goal of each combatant is to defeat his or her opponent, sometimes in brutal fashion even.
Our objective is to knock our opponent out unconscious, to inflict so much pain and damage on them that they tap before the entire world.
It is generally not to do so in a way that could potentially deform an opponent or end their career. The oblique kick is certainly a technique that can do both. And in mixed martial arts, if you live by the sword, you can certainly die by it as well. One only has to look to Anderson Silva, Chris Weidman, and Uriah Hall to know that things have a way of coming back to bite you, even if not intentional. The goal of the oblique kick, if carried through to completion, is to maim. Other techniques that can maim are disallowed. The oblique kick should be no different. So what do other fighters say about the oblique kick? Some fighters feel that the technique is no different than any other technique allowed in mixed martial arts under the unified rules. They feel that it is a fighter's responsibility to be aware of the technique and defend against or react to it accordingly. Even Bukauskas stated this after his injury. A social media post after the fight showed Bukauskas congratulating Roundtree on his victory and assuring him that he harbored no ill will after the injury. Bukauskas went on to ask his followers on social media to cut Roundtree some slack, as he did not feel that any malice towards Roundtree was warranted. Gracious in defeat, even when debilitated. So what do you think? Should the oblique kick be banned in professional mixed martial arts fighting? Let me know whether you are team ban that crap or team let her rip in the comments down below. As always, that's been a word from Dr. Chris, not your everyday ortho.
The Flesh Wound.